All right, welcome, Dr. Emily Bennett. So we're talking about shame in healthcare, and this is
Yeah.
a topic that I think has always been near and dear to your heart, but that I've seen you evolve into, especially more recently, as like really standing behind it as like the main sort of focus in your practice. And maybe you could say a bit more about that and how you found this path.
Yeah. I've been really lucky since I started practicing to have been working in environments that cater to specific communities that are looking for not just alternative care, but alternative care, like alternative care and alternative environments. So when I first started practicing, a lot of my patients were part of the queer community. A lot of my patients worked in frontline work, social workers, people who were doing the hard work of caring for others without, a lot of compensation or care for them. And it also just ties into communities I've been a part of for a long time before I started practicing naturopathic medicine. But the theme kind of coalesced. People, you know, wanting to see me because they know that I had space for different identities, space for unusual um, lifestyles that maybe are not that common, that other practitioners responding to them with some judgment when they present their work as a sex worker, or things that are maybe not mainstream. And through the privilege of like working with folks with different experiences, I was educated myself in understanding the impact that shame plays on people's access to healthcare and the experience they have in healthcare environments. I would say that the first like most clear example of this that consistently comes up for people all over the place is around body size. A lot of folks in bigger bodies, fat folks, they're very used to showing up in a healthcare environment and having an interaction with any kind of provider, whether they're a medical doctor, naturopathic doctor, nutritionist, chiropractor, and there being a conversation about their weight.
Mm-hmm.
As if it were the first time they're talking, as if it was the first time they're talking about it, like, oh, if you lost weight, then you wouldn't have this problem anymore. And I was just, I got to have a lot of honest conversations with people who were like, I can't show up with my problems and have that be the only thing people say to me again. I don't want this to be, this is my body. And like, we need to talk about other things besides losing weight. It's not that I haven't tried, but this is where I've landed. What else do you have for me? It's traumatizing me again and again to show up places and have someone comment on what my body looks like and assume that that's the reason I'm dealing with these health issues, when A, that's not always the case, and B, it's definitely not helpful or supportive or meeting someone where they're at to just give that recommendation. So I think that, yeah, the kind of coming to this idea of like shame in healthcare is coming from all those experiences of really wanting to was seeing the most of and care deeply about and understanding the problems that lots of folks were facing. And yeah.
Yeah, it's a huge one, right? Because it's like this
Mm-hmm.
idea of, the weight is the underlying cause of everything that someone's dealing with. And then how that manifests, which first of all is not even true at all. Like, and we know from a scientific perspective, but then also just preventing somebody from even seeking care at all, knowing that that's going to be the recommendation and they're not going to be taken seriously, they're not going to be listened to. They're going to be judged. And there's this underlying thing, which I think is difficult in our profession too, of working with lifestyle medicine, just in general, what I've been noticing is like looking for, these gaps in lifestyle foundations. And then if I'm not careful, seeing myself come at it from a place of like, what is this person, quote unquote, doing wrong? You know what I mean? Like, we're looking for like, okay, so what can we improve when it comes to food or movement or even self-care? Like, all of these things have like a slight nuance on like, this is how someone can improve. And so a lot of the recommendations, like, if we're not careful, have this taint of like, I have the answer and this is how, this is what you're missing, or this is what you can add, or,
Yeah.
and
Yeah.
yeah.
I think like, yeah, there's an aspect of, recognizing that, and if I'm a so-called trauma-informed practitioner, where a person who, one of the aspects of being a trauma-informed practitioner is to truly be willing to meet people where they're at again and again, to not draw lines in the sand and say, look, this is not going to improve unless you take gluten out of your diet or whatever, when perhaps that is an inappropriate recommendation for that person, and you haven't made the effort to understand that that is the case, and then find another route that meets them where they're at and doesn't prevent them from coming back or seeking care from someone else again, because they fear that again they'll have this line that they are not allowed to that they must get over in order to like improve, and it's not possible for them to do it.
Right.
Yeah, so much of there's so much to say about it. It's a tricky thing in the world of wellness, where some of the time we stumble upon things that do seem like easy answers for people who are able to take those steps. But like the true work of being a practitioner, where doctor is teacher versus doctor has the answers, doctor is the guide, shines a light on paths that are possible to take you to where you want to be. It's like you have to I feel like it's that you have to reach it again and again to remind, to be in that interaction with each individual patient and say, let's have an honest conversation about what's going to work for you, and find something that will work. I think something for folks in our line of work that also is really worthwhile discussing is the lack of sensitivity around disordered eating and eating disorders. There's always a nutritional component, and really, each individual person needs to be screened for patterns or history of disordered eating or an eating disorder, in order to feel confident that you're making a recommendation that isn't going to cause harm for them in the long run. It's not. We've all had the experience of, recommending something to someone, and then they've fallen off. We see them 2 to 3 times, and we don't see them again. And maybe you never got to have that conversation where you said, the idea is we learn something from, perhaps you have taken them through the process of removing something from their diet, and you want to learn something from that and figure out how to adapt to a lifestyle where whatever, it's not, you're not running into the problem where that food causes the symptom they don't want. But they fall off and you don't get to go through that. And perhaps it leads to them doing harm to themselves because they believe that they mustn't eat this thing or else something bad will happen. And that is connected to shame in a variety of ways also. I don't know. It's really it's an interesting, I think that it gives us the opportunity to really think of those principles of naturopathic medicine again and check out the ways that we are not maybe honoring them in each of our interactions with our patients. Yeah.
It reminds me of how insidious shame is and in healthcare in general, and how that percolates into what we do as well. We're not definitely not free of it, right?
No, personally, yeah.
And I'm just thinking of how many patients have come in, patients that maybe I have worked with that we didn't have a conversation that was explicit enough, or we didn't get to that core of shame properly enough, perhaps, or patients that have come from other practitioners where that was the message. It was if I eat gluten, I'm essentially a bad person, or if I eat this way, or if I haven't lost weight, or weight loss equals health. This insidious message that I see time and time again, when even the word diet, I have to be careful of, because when we hear that word, we think of weight loss essentially, or caloric restriction. When maybe what we're talking about is the way that one eats, but if we don't actually flesh that out and make explicit what we mean by the word diet, or what we mean by taking out gluten as an experiment. Okay, here's one pathway. We could take it out for a couple weeks, see what happens. We're going to reintroduce it, see how your body responds. It's not about whether this is an evil food that, everyone who consumes is going to just be condemned to bad health, but there are these little, and we might think, on the 3rd visit we'll address this, or we'll get into all of this. But like you said, people can be falling off earlier than that and stuck with that, sitting with that message of, I was supposed to do this detox and I couldn't do it, or it wasn't appropriate for me to do it, or I'm still doing it thinking that this is the way that I healthcare practitioner that I
This is the
trust is
only
telling me to eat.
way.
Totally. Yeah.
Yeah. Sorry, I have a thing popping up my yeah. I think too, one of the things that was um so in the kind of like bigger conversation I've been recently having all these conversations, as you know, with different healthcare practitioners around shame. And one of the people I spoke to is a psychotherapist local to Hamilton, who reminded us of the work Brené Brown's done. Obviously, she's like very well known for talking about shame. And one of the distinctions that was so helpful to revisit, which she discusses in one of her TED Talks that you can easily find online, is that distinguishing between shame and guilt. Guilt is something I did. Shame is something I am. Like when you think of how harmful it must be to be living a life where you are internalizing, where you have internalized the things that a healthcare practitioner says to you with the interest of your health and taking care of you, and it leads to shame, it leads to withdrawing, it leads to feeling unsupported, and that one is bad, not has done something bad. It's really like, it's, when you think about it, it's devastating to think that you might be having that impact on people sometimes without knowing it, just by not carefully considering sort of myriad things that make up a person and their experience.
Totally. Yeah. I mean, I was thinking about that distinction before this talk about, like guilt being, I've done something wrong or something I wish I hadn't. Like my dog this weekend who ate a dead porcupine, and we had to like poke holes. Yeah.
Yeah.
He was like kind of ashamed of like his decision, which was not a good one. But then shame, which is that I can't even, every time I interact with a healthcare practitioner, I'm going to get the same recommendation, the same piece of advice because of who I am, which is wrong, and which is somehow contributing to my whatever symptom I come in with. This is what you're saying. I have a headache, diabetes, whatever it is, and it's like there's always going to be that recommendation of weight loss. But people have that experience, and sometimes it can be extremely subtle, and it can come in the shape of compassion. Like we're here to help, and we're here to listen and take care, exactly, and take care of you. But this underlying subtext, which we might not be intentional about, as you said, it might just be the way that things are framed, that we're unaware of that person's experience or the journey that they've taken until they've arrived at our office. What are you finding people have been saying about the ways that we can have those conversations? Or what have you found is helpful, or what have your patients told you has worked for them?
Well, I'm sure a lot of people who are in bigger bodies or identify as fat, who show up in your office, and they'll always mention weight loss to you because they know that it's going to come up. And so they'll say, I'm here because, my PMS is out of control. It's ruining my life. I need to work on it. Also, I get migraines, and of course, weight loss. And always in my free alignment appointments, 15-minute appointments before we kind of like get going, working together, I always straight up am like, well, what do you mean weight loss? Like, what do you, I'm constantly, this is only one aspect of this shame thing, but with respect to that, I'm always just like, let's talk a little bit about what you mean when you say weight loss. These are my beliefs. I really believe that it is possible to have health at every, and how would you feel if we go through this whole process together, and like you land in a place that for you feels like optimal health for where you're at in your life right now, and your body shape and size doesn't change at all. And in fact, with everything that we look at, it says to us, you're in great health, you feel great, you have a wonderful sense of well-being, and yet you haven't lost any weight and your body doesn't look any different. How would you feel about that? Because I am not somebody who is, I'm not going to push weight loss. I'm not the person to come. If weight loss is your goal, then, I would love to have a conversation with you about how we can like make sure you feel great about the way you're eating. You feel that when you eat, you're eating what you want, that it's filling you up in the right ways, that you're aware of why you're choosing to eat what you're choosing to eat. And, that there is this intuitive aspect to it. Same goes with movement. Same goes with all the things that like the main thing that like the long-term outcome I want for everybody I work with, I want that to be deeper connection with your body, full embodiment, to know, to just feel like at home with oneself and at home with your place in the world. And even more importantly, like resilient and ready to go and do the hard work of existing in the world to dismantle oppression and engage with like the work that we need to do in order to make it a fair place for everybody. So, that's how I see it come up all the time, is exactly like that. Somebody who really actually doesn't give a thing, but bring it up because they know that like it's going to come up. So they just want to let me know. They know they should lose weight. And then it's like, that's a wonderful opportunity for me to say, let's get into that a bit and just explore why you're saying that right now. I don't know if that answers your question.
Totally. Yeah, definitely. It's really unpacking that, as opposed to just taking it for granted. Like, okay, this is this person's goal. Really understanding, where did that goal come from? Is that something that's actually important? And, if you achieve every single other, health outcome, but a lot of people don't even know that is possible, right? It's like this sense of embodiment. I definitely have had conversations with patients whose goal was weight loss, and we had conversation around, like, it wasn't as nuanced as the conversation you're talking about, but I remember as an intern, we would say things like, so how, would you feel, when you've achieved this goal, or, what do you think would be possible for you? Like, what is the meaning behind this health outcome that you're looking for, if it's weight loss or whatever it is? And sometimes there'd be this disconnect of like, well, what do you mean? Like, I'll look good in pictures, and, and then it's worse when it comes from like other healthcare practitioners saying that, well, this is the road to fixing your PMS. Just really interesting in terms of, how we can really think of like, oh, could I, be healthy without this weight loss that everyone is telling me that is absolutely necessary in terms of, There's
this wonderful, one of my the people I've learned the most from and who I am indebted to again and again is Sonia Renee Taylor. She has a book called The Body Is Not an Apology, and an organization by the same name. And in The Body Is Not an Apology, she references this video by, I believe, a psychologist, I can't remember their name, called Poodles Science. It's a really amazing video, and it's like an animated video to try and explain this. The idea that in this video, there are so many different kinds of dogs. They're using the idea of dogs. And when we talk about, the people we have been studying and the people who are doing the research and caring for most people are poodles. And they keep trying to turn a mastiff into a poodle. And the mastiff can't become a poodle. The mastiff will never become a poodle. And in fact, the mastiff just feels bad again and again that like they can't become a poodle. And yet the poodles keep telling them that like the only way they will achieve what they need to is by becoming a poodle. And that's the thing that I want, like the brain shift that you could have. I remember having a conversation at the very beginning of my practice with a person who is very dear to me and has provided me with a lot of generous education on all sorts of subjects, like around the communities that they are a part of. And they were dealing with something that was a hormonal picture. They're in a bigger body. And I said, I referenced how the research does tell us that like, there's a relationship between like how much fat you are carrying in your body and estrogen dominance, blah, blah, blah. And like, it was their like gentle kind of like listening and response. They've heard that before. The response that they had as I was saying it, I was like, I don't want to say this to you. I know that like, that, and this is not a helpful conversation for you, but I feel like I have to say it because the research says it's true. And it's just like, well, what if you just shift the way you're thinking to think that a person in this body has a different relationship with estrogen than a person in this body? And so like, you maybe have to accommodate for their symptoms in a different way. You're dealing with each body is a constraint within a closed system within which you're working to bring about what feels like health and well-being optimized for them, and trying to turn them into a poodle so that you can use the same tools you use for the poodle to deal with the symptoms isn't possible, and it's going to cause harm for them in the long run.
I love that. But there's also this idea of like our body is a response to a bunch of different things, like perhaps genetics, but I'm even thinking about just like environmental shifts, right? And that's like, so a poodle and a mastiff have differentiated because of certain sort of like evolutionary pressures environmental pressures. I mean, it's been an artificial means of selection to turn, like, to turn a dog into a mastiff versus a poodle. But, some people, like, health may mean to be in a bigger body because that's the way the body has responded to a variety of different factors that we're unaware of. And to just simply like force the body to be a different size in the name of quote unquote health makes very little sense from that perspective. Like, I mean, I've definitely had weight loss as a recommendation in my own health journey, which is kind of absurd because I'm still in a quote unquote normal BMI, but it has been a recommendation. And when my body was smaller, my hormone, like, I stopped getting a period. So my body didn't want to be whatever 20% body fat or whatever it is that is the standard, the optimal that is perpetuated in the medical system. And so it sometimes, it makes very little sense. And if we're working with PMS, like, well, are there other reasons beyond body fat that someone could have PMS, and even beyond estrogen, right?
Yes. Yeah. Let's talk, like, I've done a little reading, like, in, looking into what's being written in the kind of medical ethics side of things around subjectivity in healthcare. Like, can we imagine maybe that truly each person's health is a collection of their subjective experiences, some of which have, clear impact maybe on like the health measures we can take through blood work or imaging, and some which we cannot quantify or see. A person's life experience contributes to their subjective experience of health. What is health? It's like well-being, like it's not a person, there's just so many factors to take into consideration, and you have to give your patients an opportunity to do their best to start to begin the long-term path of defining for themselves, like, what does health mean for them? How does it, like, where can we uncover all the little bits that allow them to feel like they are feeling their best for where they're at right now, given their experience. And it's complex, it's very complex, but I feel like there's such an opportunity to like deepen your relationships and find paths to really finding healing for people that you're working with by taking that perspective, like I'm inclined to say something about like genetic medicine and epigenetics and stuff right now, but to be honest, it's not something I've thought very much about. But I think like we're really, we want that to be the answer. We want to be like, oh, go do one of these nutrigenomics, whatever, I don't know, one of these tests, and it'll tell us everything that you need. But it's just not true, like even that can't capture all of the things that contribute to your overall sense of like you at your best, where you feel your best for right now. And there's so much of our experience is qualitative, and there needs to be space for that in healing and in a patient interaction.
So interesting. Yeah, I really am interested in that idea of health as subjectivity, like it's subjective, and because I think we might just hold this in our philosophy, this implicit idea of health being a final state that we're trying to achieve, and that makes zero sense. There's and I think, what you're proposing or what you're talking about is, like deepening this relationship with a patient to really understand what is health for them. Like, where are we headed? Like, and is the direction that I assume we're going in because of my implicit values or biases, is that the same direction that you want to go in,
I mean, like, what a good transition to take us to what is occupying the world right now with anti-racism, anti-Black racism in particular, and say like how important it is for frontline workers who work directly with people, including naturopathic doctors who definitely do not get access to the general population because of the way that we are paid in Ontario, I can speak for. But, to examine your own biases, to examine how that you and how you're speaking to them, and to really be prepared to do some hard work, because you are that, these things, if you are white, you are from privilege that is also impacting the way you work with people, and it may not be something that you have found awareness of yet. It's so important for everybody, but is especially important if you are showing up as a leader or an authority figure in relationships one-on-one with people, and really, making sure that you're meeting a person where they're at, understanding that you perhaps have no idea what their experience is like because you have not had the same experience. And there's a lot that needs to be done for people who work directly one-on-one with folks, and for sure for naturopathic doctors in particular, because our profession is still new, and it is not really, flushed out with these kind of like basic, anti-oppression approaches that something like social work is, where that's, like in most approaches, foundationally a part of how folks interact with people in that kind of work. Yeah.
Mm-hmm. Mm-hmm. Yeah.
Very
Like what have you been finding in terms of, because I know that this is like, the recent events and the BLM movement has been highlighting, like we've started to look inwards as a profession to understand like where have we been lacking, well, understanding the lack of education we've had around anti-racism work and anti-oppressive work in our education. And you were even saying before we started recording about even how we like, understand risk factors, related to race and ethnicity. And how the way that has been studied is extremely problematic because it's not taking into account social determinants of health and all these other factors. But what kind of things have you been learning?
I think, like, just to speak to that for a moment, like it's very obvious when you are in an environment learning about like the so-called objective facts of risk factors and that kind of thing, and then maybe in a different class discussing social determinants of health, and not tying those two things together to say, okay, like when we're talking about like a population that shares like this social category of race or perhaps an ethnic background, and saying that they all have this particular risk factor, well, okay, can we talk about why that is the case, and what's the bigger work to do here if like we're finding that like rates of diabetes and then kidney disease, et cetera, are higher in populations with African heritage, Black folks. Like if you are, it's not, it is it's harmful. It's very harmful, and it's keeping us stuck in old ways of old ways of practicing medicine that are deeply rooted in white supremacy. And I don't even know actually how to speak to some of your question. I'm not involved in, I'm not that involved in our profession. I have been an activist for a long time. I'm really involved in groups in my local community that are really trying to actively work to get better at the anti-racism work that we've already been doing. I know that a lot needs to be done in naturopathic medicine, I'm not that involved with the profession itself at this point. I know, like, a couple of years ago, because of the clinic that I run in Hamilton, where we have tried to use accessibility as a jumping off point for understanding how we can interact with different populations that don't get a chance to interact with naturopathic medicine, or just choose not to interact with naturopathic medicine and complementary healthcare, and to really like use our brains to think about why that might be the case. Started out with like talking about financial accessibility, and then it's like, well, who's working here, who's showing up, who is not showing up, and like let's go talk to them about why are they not showing up. Do they not feel welcome? And it's been a journey of like understanding that accessibility goes so far beyond financial accessibility, physical accessibility. And I got to speak on a panel at CCNM a couple of years ago with a few other wonderful practitioners. And I think that, CCNM is the school in Toronto for naturopathic medicine, that there are some good things that are happening on the ground there to try and like work on the massive problem of, diversity and white supremacy, in the wellness world.
Mm-hmm.
Yeah.
It definitely, it's a prominently white profession. And it's, I personally don't know how to approach these conversations, or maybe, yeah, what my place is as a white practitioner in terms of like opening up that dialogue, or even understanding, or like, I don't know what you've found in terms of listening to the Black community, and as we started to expand the conversation around healthcare and health practitioners and the alternative healthcare space, in terms of like the ways that we can listen, or make our practices more accessible. Yeah, I don't know. I don't know if my question makes sense.
I do this right now, besides like we need to elevate the Black voices and Indigenous voices and folks of color in our profession right now, to allow them to occupy space for leadership. It's important that we step aside and allow other people to, to provide direction if that's a role they want to step into. We need to make space for that, because I experience I am learning, and I need to, my role is to sit down and listen and create space to elevate voices, and to speak to other people like me, other white folks who maybe don't realize that, like, standing at the front and yelling about this right now in general, while important, it's important to have conversations and educate those around you who might, this may be new for. It's especially important that we create space for Black leaders, for Indigenous leaders, for people of color to tell us what they need.
Especially, I mean, I was having a conversation with Fernando in a previous episode about insights into communities that we want to work with or find ourselves working with, and how, as an outsider of a particular community, there can be so many things that go wrong with just not understanding particular community needs, or where they're coming from, superimposing our values and our objectives and our needs onto that community. Like, there was just there's millions of examples, but the one that we used in that episode was that a organization that was providing mosquito nets to prevent malaria in a population, and the community was using those nets to fish. And they were like, well, how do we convince them to use these nets to prevent malaria as mosquito nets? And it was like, well, that's not what the community needs, clearly.
Yeah. I mean, a really like a non-healthcare example that is really useful to point to right now is, like, there are people who have there are white people right now who are feeling the energy of what's happening, and they care, and they feel really strongly about doing something, which is important. And so they are trying to organize events and show up and say, I'm here because Black Lives Matter and whatever, without working with leadership from the community of Black activists or BIPOC activists in their community. And so without taking the steps that ensure the safety of everybody who will be attending, without understanding the nuances and the relationship between, for example, the police and Black folks in that community. And so, like, it isn't safe. It's not just inappropriate. It's not safe for people who are not a part of the community to stand up and say, this is what we need right now. We need to, you need to step aside. You need to invite people to come and say, you need to say, we don't know, we are making mistakes. And if this is a role that, is one that you want, then we need to move aside for, we can't come, we're not going to parachute in and fix any of this if we are also just a part of the community of white people who have been making mistakes and who are totally bathed in their experience of white privilege without, being able to, it's really complex, and it will be a constant learning process, and it'll be really wonderful to see where things go. We just must persist. We must stay consistent. We must take care of ourselves so that we don't fall off of this, because it will be painful. It will be full of shame for white people. It'll be full of shame because we are complicit in something that perhaps some of us have not been aware of until now. And it is really tough and necessary work.
Mm-hmm. Yeah, I mean, like it
Yeah.
sounds like it, that just perpetuates more of the same, right? Where it's like you're just, again, just pushing like a white agenda, and without necessarily doing like the deep inner work
Mm-hmm.
of
Mm-hmm.
evaluating one's own motivations, and then also paying attention to the community and letting the community lead.
Yeah. Yeah.
Yeah. hmm
Mm-hmm.
And then, I mean, from a healthcare perspective, yeah, as you're
Yeah.
mentioning, it's like deferring to healthcare providers who are working closely with those populations or belong to those communities. Like, what are you finding? What are the main mistakes that we're making? And asking those questions. It's hard to even know what
Yeah.
questions to ask, though, right? When you're
Yeah.
an outsider of the community.
Yeah.
Mhm.
Yeah. Definitely.
Yeah. And I know you were talking about certain tools that you implement, that you use, or that you found have been helpful, in terms of supporting people. And can you maybe speak a little bit about that?
I don't actually know what you mean.
Oh.
So,
Like, I don't know, like, I think you mentioned, like, some of the tools in terms of like what people have found helpful in their own healing, or some tools that have been useful in working with patients in general, to support like an anti-oppressive sort of framework,
mm,
or.
mm. I mean, yeah, like one yeah, so I mean, like there's kind of two. I don't really, things are evolving for me as they are for everybody right now. um Being as we're in the midst of the pandemic too. um and there's kind of two ways I'm thinking about the work that I've been doing. One-on-one, I pledge to continue to try to meet people 100% where they're at, and to use my role to help them elucidate where they're at and where they want to be. Sorry, my microphone's dying.
That's okay.
um, and as a leader in this, for the people that I work with, I really feel strongly about providing the tools for white folks in particular to maintain the momentum that they have right now, to provide space for people to share what is hard for them about like engaging with this work for the first time, for the second time, for the 100th time, to find that it moves slowly most of the time, and that even like given that you must take care of yourself in the midst, you must, finding space to take care of yourself, creating consistent ways of contributing to the anti-oppressive work that needs to happen, allows for you to be consistent in other places in your life with taking care of yourself, so that you can maintain the momentum, so you can keep showing up without feeling totally desperate and depressed, because change is often slow. We're in this like incredible energetic moment where big things are happening, but probably what will happen on the other side of some of this will be that things slow down again, and we still can't give up. And so I really want to stand up in my role as a leader to say, like, I can help, we can find ways of like keeping you in a state that allows you to continue to show up too. And that for me is like the thing that I want to do most for folks, is to support them so that they can show up in the way that is meaningful for the world, for dismantling oppression, for the liberation of Black people, for decolonization of where we live, on Turtle Island entirely, and to just like support folks in that journey so that we can move to a place where we need to be. The tools are really about, so much of what we need in that process involves body awareness, involves deeply embodying your experience by recognizing how you feel when you have certain experiences, when to integrate practices like intuitive eating along with like embodied movement, and paying attention to how you feel, and allowing yourself to be, incorporating that with practices of mindfulness. And yeah, it's big stuff. I don't know, about this stuff.
I love it. I love how it comes back to a lot of this is coming into body awareness, as a
Yes.
way almost to, I don't know if the word is dismantle shame, but like, I mean, I can imagine though that's like, if someone's living with a lot of shame, to start to look into the body where a lot of shame lives could be really
Yeah.
hard.
100%. And that's, you know, like one of the reasons I love so deeply and am indebted to and appreciate greatly the work of Sonny Renee Taylor is that she very much is, you know, we need to accept the differences in ourselves to better accept the differences in the world. Like when we deal with our own personal shame, it allows us to see how we inflict shame on others because of their own differences. Like the key to liberation and decolonization and dismantling oppression is to also look to the ways that we, you know, that I internalize my white privilege, that I internalize, like, you know, states of oppression, and how that leads to my own shame around, like, my body, the way I behave, my thoughts, my feelings. And to, yeah, deepening body awareness is like it's not, again, just like you said before, it's not a state we'll achieve, it's an ongoing practice. But the better we get at it, just like meditation, the more you practice, the more readily in a situation where you require mindfulness, you can access it. And I think that, like, the work personally and the work, you know, besides the action that you're taking right now, probably reading, I hope, reading books, having hard conversations with your families around anti-Black racism, donating your money places, yes, 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 but also turn inwards to yourself and examine, like, be with your own feelings in this, acknowledge how you feel, acknowledge the feelings of guilt, shame, sadness, anger, energy that you might have, and give attention to it. Yeah, it's exciting, it's wonderful, it's so great that we're in this moment, and it's also terribly difficult and heartbreaking and challenging, and so we must find ways of remembering and doing our best and maintaining our ability to show up and do it again. Yeah.
I'm slowing, the parallels of, like, paying attention to, because, you know, so, I mean, what we've been talking about can generate shame in healthcare is this idea of, like, external markers of health, right? Or, like, quote unquote health, versus looking inward and really developing a relationship with one's body, which we're often discouraged of doing, because you're put in, like, the example of being put in a diet. You're told to kind of cut off your body and defer to this.
You're hungry, ignore it.
Totally.
You desire, like, a delicious, rich meal. You desire something, like, sweet and easy to digest, super carby, because you've just expended all this energy, or just because you want it. You're discouraged, from paying attention to those signals, for sure. I mean, like, I can't believe how revolutionary it is to suggest to patients, you know, a patient comes in who's really struggling with lots of thoughts around eating, who has patterns of disordered eating, who eats when they have feelings and assumes that that is bad, to say, it's not bad. That's, like, a legitimate self-soothing strategy that you have. Wow, it's so, you know, that's lucky, you know, that works. When you feel bad, you can go eat a bunch of ice cream and it helps you feel better in that moment, versus something that truly would be harmful to yourself in that moment. And so, like, making the connection between, like, just pausing, you know, just to say, when you have that desire of, like, something in the evening goes on and you're just like, wow, I just need to stand over the sink and eat, like, a whole thing of chocolate ice cream, like, awesome. But also just pause for a second and notice how you feel in your body. Name the emotion you're having right now. Like, oh my God, I'm exhausted. And the feeling I have is whatever the feeling is. And then thinking again, like, is the ice cream over the sink the thing I need? Yes, it is. Okay, awesome. Go have the ice cream. Or maybe you realize, like, oh, after checking in with my body, I can tell that the thing I need is to go to bed right now, because I'm exhausted. I have really had a hard day. And so you can choose that, you know, and it's, the deepening the connection with the body, the work of, you know, intuitive eating counselors who are really revolutionizing the way that I think that we can talk about interacting with how you eat and the role food plays in your life is really magic. It is powerful, and it can lead to, I think, so much more awareness in other aspects of our life too. And play a huge role in dismantling that everyday shame that we live with.
You have a Facebook group called Shameless.
Yes.
Learn more.
Yes. Yeah. Facebook group called Shameless. We do interviews in there. It started during the pandemic as a way to share resources to support people through the, like, challenges that they're encountering during this time, that are anti-shame, that do not promote shame, so that, you know, it's a safe place to land, to to feel comfortable with what we're all dealing with right now. I'm also on Instagram. You can find me there
We'll put all the
talking about
links up.
all the same stuff. Yeah. Yeah.
Amazing. And anything you want to leave off with, like any last thoughts or last words to wrap up this conversation? This is great.
Yeah. Yeah. If you're feeling, yeah, I think just like repeating a lot of what I've already said around like, if you, to speak to this moment right now, you know, post the murder of George Floyd, post the, you know, the dissolution of the Minneapolis Police Department. Like, we can and we must, if you are a white person listening to this, as I am a white person, we can and we must maintain this energy. And so in the process of that, make space to take care of yourself, make space to develop that body awareness that will allow you to see when you need to rest, when you need to fuel, when you need to find joy to play, so that you can continue to show up and do the hard work without the hard work we need to do without falling apart.
Amazing.
Yeah.
Thank you
Yeah.
so much. Thanks,
Yeah, it
Emily.
was wonderful chatting with you. Have a great rest of your day.
You too.